Welcome to My Week. We are glad that you're joining us. I'm Christy McDonald. We're coming to you from our Midtown studios in Detroit this week, where the question of public safety and what is being done to address violent crimes is of major concern. Plus, we'll talk more about potential plans for foundations to step in with millions of dollars for Detroit and Mike Duggan's plans for his first year as mayor. Also coming up, speaking of millions, ad money promises to be big in 2014. Plus, we have some new poll numbers in the governor's race. But we start first tonight with more fallout from the Affordable Care Act. Here in Michigan, some lawmakers have floated a bill that would make insurance companies explain exactly what price hikes are attributed to Obamacare. So let's get started with our contributors this week, Nolan Finley from the Detroit News and Stephen Henderson from the Detroit Free Press. Gentlemen, it's always good to see you, and we're downtown this week.
This week, yes, excellent.
All right, so let's wade right into it. I'm always afraid to throw the grenade into healthcare with the two of you. But let's start this week talking about what Michigan lawmakers are talking about, making insurance companies, when they send out their notes about their rates, making them explain if some of those rates, the rate hikes, are due to changes in the Affordable Care Act.
Well, it's just a silliness. I mean, of course, the rate hikes are involved with the Affordable Care Act. If you mandate more coverage, put more sick people on the insurance rolls, insurance rates are going to go up. It was foolish for anybody to believe otherwise. These lawmakers ought to be telling us, what's going into making our taxes so high. They should take care of their business.
Itemize the taxes.
Okay, well,
our pork this much. I mean, this is just grandstanding silliness.
Oh, so they shouldn't have to spell it out?
No, they should be accountable to their customers and not to a bunch of meddlesome lawmakers who are just going to mandate more paperwork and more costs.
And
that'll
drive up. Part of the cost increase now will be we have to itemize. We have to itemize.
Yeah, how about this? Mandates put on by state legislature over the years that have added to insurance costs as well.
So
they play a role in this.
Is this just political then?
Well, it is. But I mean, there's a good point here, which is that everybody is blaming everything on health reform, and some of this stuff is not about health reform.
Which part?
Well, go back. Go back several years with our own health insurance, Nolan. Premiums go up every year, an average of 15%.
No, 5% a year.
Okay, you say 5, I say 15. We'll split the difference.
All right, tomato, go.
But my point is that costs were going up anyway because there were too many uninsured people in the system. There were too many uncovered costs. The whole idea of reform is to get more people insured so that you lower those costs over time.
And I would agree with you, Steve, that costs were going up.
Yeah.
And that's why from the beginning we should have addressed costs instead of addressing excess without costs. So you added more people to the same inefficient, costly system, and that's why your bill's getting to be so stinking high. I mean, again, you look at these deductibles and premiums. We've been talking a lot about the individual policies.
Sure.
You buy your own policy. But the people who have employer-provided health care, it's no picnic for them either. No. I mean, their premiums, their deductibles are going through the roof. And
it depends on the employer, of course, because a lot of employers, again, my wife who works for a museum, her coverage isn't really changing at all. There aren't price hikes, but they aren't being hit by the same taxes that our employer, for example.
Eventually it's going to go up, and the people covered under union contracts aren't seeing the hit yet, but they will when their contracts expire.
Obviously,
and they have to be renegotiated.
There's big problems with the implementation of the entire Affordable Care Act, and the president is suffering for it. Just this week, approval numbers came out. He's at 37% approval rating, and also looking at the number of people who support Obamacare is now at 31%. What are we seeing happen here, Nolan?
Well, we're seeing a revolt. People are starting to realize what's happened to them. And, I think there was never a majority support for this law. At best, it got to about 50-50, and that was only for a brief period. People have always been opposed to the law, but now that they see the impact, I think that you're seeing that escalate and intensify. And you saw the president last week try to mitigate with this, we're going to delay or you can keep your policies you had or whatever. They can't keep the policies they had. That's water under the bridge. He's just now going to make it even more costly and confusing with what he did last week. I think they need to stop right here, get in a room, bring the insurance companies, employers, Republicans, Democrats, and come up with a plan that addresses cost and provides perhaps tax credits for people to buy their own insurance and get out from under
The
this
tax
mess.
credit thing is that's a good idea, and where were Republicans 4 or 5 years ago when we were talking
They were
about
screaming
this?
about
They were
that.
not talking about
That
this.
was
They were
their
screaming
plan.
about the public option, which again would have been a great idea as opposed to the mandate. I mean, the problem with this from the beginning was that it wasn't ever about fixing healthcare or not fixing healthcare. It was about stopping a president that they didn't like, and so they didn't
And
bargain in
pushing to
good
a
faith.
liberal agenda.
Well,
All right,
fine,
but
but,
let
they
me-
didn't, but he won the election.
Let me
So-
ask you this, but can
He
you
wouldn't
at
have won
this...
it. If this had been last year, if this had impact, and they cleverly designed
But
that so
again,
the impact
if I had
comes
wings,
post-election.
I'd be an angel. It
Yeah, I
doesn't
don't think
matter.
you can
It
look
doesn't
back and
matter.
say if then, because you
Sure
could put
can,
you could put
because
in all
it-
sorts of
because
different
it was
scenarios.
designed to get the impact would fall after the election. So
But
there'd be
most of the
no
impact,
accountability.
But
My
most
question-
of the impact, the expansion of people with pre-existing conditions, that took effect before.
Oh, the good stuff.
Well, yeah, and that's the point. Is that the
No,
bill
the
is
point
full of
was-
some good things and some
and
things
a
that
lot of
aren't so
bad
great.
things, a lot of costly things, and they designed it so those things would happen after the election, so
That's
Obama
just smart
wouldn't
politics.
be accountable.
All right, let me ask you this. My question is, can you stop right now and put all of those people in a room and
You have
change
to.
and change the course? Is that a possibility, and is that the right thing to do?
I think it's what will happen because everybody is now sort of in the same boat. You got Democrats and Republicans on the Hill saying this isn't working, and we can't go into the elections next year with people feeling the effects of this way. So finally, there is enough incentive on both sides of the aisle to actually have a conversation about this. But this is not the first opportunity to have done that. Democrats tried very hard
they didn't
in
try.
2009 to include Republicans.
That's
in
revisionary.
the-
What they
it's not,
did was
because-
say, we've got a veto-proof majority. You sign on to what we
no.
tell you to sign
What
on
they
to.
did-
If they had not had that veto-proof majority
So then why
back
is the-
then, you would have had a law that worked better because they'd
So-
have been forced
So why
to
is
take
the bill?
Republican
Why is the bill
ideas.
so full of Republican ideas? Where'd
Because
the mandate
they must
come
have
from?
been good ideas.
Where'd the mandate
They
come
must
from?
have been good
Where'd the
ideas,
exchanges
Steve.
come from?
All right, let
I mean,
me-
These
The
were
exchanges
all
aren't a bad idea if
They're
properly
great ideas.
executed.
They're
But
great
you
ideas.
can't, you've got to allow more flexibility
But the
in the
idea
system,
that-
and you've got to address costs first, Steve.
We
All right,
agree on
Stephen,
that.
finish your point.
We agree on that, but I mean, I think the point is that Republicans were given a lot of things to get their votes. In 2009, they gave none because they were dead set on stopping the president from doing what he was elected to do. He said what he wanted to do during the campaign in 2008 was one of the first things that he did out of the box. That's it,
All right,
A lot
hang
of
on,
people
hang on,
wishing
hang on.
now that they had stopped it.
All right, so let me ask you this in terms of looking at this politically. What does this do for 2014 for Democrats and for Republicans? This
Well,
single issue.
If the election were held today, it'd be a wipeout, but the election's a year
again,
away,
these are it.
and lots of.
Are people going to remember
time-
this more than they were going to remember the shutdown?
Depends on, oh, of
In
course.
terms of
the
going
shutdown
after the
is-
Republicans
Yeah, of course.
for the shutdown and going after the
Nobody-
Democrats
Nobody
for
can even remember the shutdown now.
Because this is pocketbook stuff. Every month you write a check and you're writing $400, $500, $600 more. Every time you go to the doctor and it's all of these out-of-pocket expenses, you're going to remember that. That's why I think there will be a fix. There'll have to be a fix. or
Well,
this
and
will
the
be a
question,
rout.
the real question is how do you control costs? Nobody's got a magic pill for that, which is the big driver in the system. Is that the costs just seem to go up because they go up. There aren't good reasons for it. So I'm not sure what legislative fix there is.
Well, we could have
for
invested
that.
some of this money in technology that would have helped.
sure.
Help
The
bring
bill
down
does
costs.
that.
You could do what the Republicans asked for and didn't get: malpractice reform, so that we're not doing a lot of unnecessary treatments and tests.
We have malpractice
You can
reform in
allow
Michigan, though,
insurance,
and it's not holding costs down.
More competition, buy across the state line, a Republican idea that didn't get in the bill, and you could do these tax credits, another Republican idea that didn't get in the bill.
Well, so far they're not looking at a lot of changes, and they've got till the end of the month to make sure that even that website gets up and running. So we'll have to keep our eye on that.